Has someone you love started showing subtle but concerning changes over the past year? Many people think that death in old age happens suddenly, but the truth is, the body often sends quiet signals months, sometimes even a year, before life reaches its final stage. The problem is, most people miss these signs because they seem small at first. It's only later, looking back, that families realize the clues were there all along. But by then, it's too late to prepare, too late to make those last memories count. In this video, we'll talk about 5 key signs that often show up a year before an elderly person passes away. Some of them might be things you've noticed but dismissed as just part of aging. Others might be small changes that actually signal the body's gradual decline. Recognizing these signs early gives you the chance to provide better care, cherish meaningful moments, and, most importantly, make sure your loved one's final stage of life is filled with comfort, dignity, and peace. Stay with us until the end, because these 5 signs can help you prepare emotionally and practically for what's ahead. When you understand what's happening, you won't be caught off guard, and you'll be able to handle what comes next. The most important thing you have left is the time you spend with those you love. Now let's get started. Number 1. Significant weight loss. One of the first and most noticeable signs that someone may be approaching the final year of their life is unintentional weight loss. At first, it might be small, a belt that suddenly feels looser, clothes that fit differently, or a once healthy appetite that begins to fade. Many families dismiss this as just part of getting older, but the truth is, losing weight without trying is often a sign that something isn't right. Unexplained weight loss can signal that the body is no longer absorbing nutrients efficiently, muscle mass is shrinking, and vital systems are slowing down. While some muscle loss is normal with aging, rapid loss can be a sign of deeper issues. The body may not be digesting food properly, or it might struggle to process protein, leading to muscle wasting. This loss of strength makes movement harder, increases the risk of falls, weakens the immune system, and makes the person more susceptible to infections. Another cause of weight loss during the final stages of life is changes in appetite. Many elderly people simply don't feel hungry the way they used to. Their sense of taste fades and food no longer seems appealing. They might skip meals or eat much smaller portions. This isn't just a preference, it's a physiological change. As the body begins to shut down, it no longer sends strong signals to the brain to seek food, which leads to less energy, less strength, and a gradual decline in health. Underlying medical conditions also play a role. Weight loss is a common symptom of chronic diseases like cancer, heart failure, or kidney disease, which can start progressing long before more noticeable symptoms appear. Even conditions like depression or cognitive decline can cause reduced eating, setting off a chain reaction where the body doesn't get enough fuel to keep going. Some families try to fix this problem by encouraging their loved ones to eat more, but the issue is deeper than just food preference. Recognizing these signs early can help prepare for what's to come. Some families try to help by offering favorite foods or adding protein drinks to meals. But if the weight continues to drop despite these efforts, it's important to understand that the issue isn't just about diet. It's the body preparing for a deeper transition. At this stage, forcing large meals may not help. Instead, focusing on comfort, easy-to-eat foods, and hydration can make a bigger difference in maintaining quality of life. If you notice significant weight loss in an elderly loved one, especially if they're eating less, feeling weaker, or struggling to stay active, it's time to pay attention. This is not just about physical appearance, it's the body sending a message. Understanding that message now can help you prepare for what's ahead with clarity, compassion, and the ability to make every remaining moment count. Number 2. Extreme fatigue and weakness. One of the most noticeable changes in the year leading up to the end of life is deep, persistent fatigue that doesn't go away with rest. It's not just feeling tired after a long day, it's a profound exhaustion that makes even simple tasks feel overwhelming. Getting out of bed becomes a challenge. Walking across the room requires effort, and activities that once felt routine, like cooking, dressing, or even holding a conversation, start to feel too draining. This isn't just the result of aging, it's a sign that the body is conserving its remaining energy. As organ functions begin to slow, the body starts prioritizing what's most essential. The heart doesn't pump as efficiently, circulation weakens, and muscles don't get the same amount of oxygen they once did. This is why many elderly individuals in their final months feel weak, unsteady, and unable to keep up with the activities they once enjoyed. Another key factor is metabolic slowdown. The body is designed to produce and use energy, but as it prepares for its final phase, that energy is redirected. Instead of fueling movement, the body shifts toward preservation. This is why energy levels drop, and even simple tasks become more challenging. Someone in decline may start sleeping more, needing longer naps during the day, and finding it harder to stay awake for long periods. Some might even experience sudden drops in energy, where they seem fine one moment, but completely drained the next. But perhaps the most heartbreaking part of this process is the emotional impact of fatigue. Many seniors who once took pride in their independence may begin feeling frustrated or even embarrassed that they can't do what they used to. They may withdraw from conversations, avoid social interactions, or stop engaging in hobbies, not because they don't care, but because they simply don't have the energy. This can lead to a cycle of isolation where they stop trying altogether, which only speeds up the decline. For families, watching a loved one go from active and engaged to exhausted and withdrawn can be painful. It's easy to assume they're just being lazy or that they need to push through it, but the truth is, forcing activity won't help. What matters most is understanding their limits, allowing them to rest when needed, and making their remaining days as comfortable as possible. If you notice a loved one experiencing deep ongoing fatigue that isn't relieved by rest, take it as a sign that their body is going through a major transition. This is the time to cherish conversations, create moments of peace, and support them without expectations. Because in the end, what matters most isn't how much they can do, but that they feel loved, understood, and at ease. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Number 3, increased cognitive confusion or withdrawal. As a person approaches the final stage of life, one of the most noticeable changes can be seen in how they think, communicate, and interact with others. You might notice that someone who was once sharp and engaged starts forgetting things more often, struggling to follow conversations, or seeming disoriented in familiar places. They may repeat themselves, forget names, or lose track of time, even if they never had memory issues before. These subtle cognitive changes can happen months or even a full year before death. This isn't just everyday forgetfulness. The brain, like any other organ, requires a steady flow of oxygen and nutrients to function properly. But as circulation weakens and the oxygen supply to the brain decreases, cognitive function begins to decline. A person nearing the end of life may become easily confused, have difficulty making decisions, or struggle to recognize people or places they've known for years. In some cases, they may experience brief moments of clarity followed by sudden confusion, almost as if their mind is fading in and out. Another common sign is emotional withdrawal. Someone approaching the end of life often loses interest in social interactions. You might notice them speaking less, engaging less, or spending long periods simply sitting in silence. It's not that they don't care about their loved ones. It's just that their brain no longer processes emotions and engagement in the same way. Conversations become tiring, loud environments feel overwhelming, and many seniors eventually retreat into their own world. You may also see changes in mood and behavior. Some individuals become more irritable, anxious, or easily frustrated, while others seem unusually calm, detached, or indifferent to things that once mattered to them. This isn't a personality change. It's often a result of the brain adjusting to the body's decline. As cognitive function slows, expressing emotions becomes harder, and the person may stop reacting to situations the way they used to. For family members, this stage can be particularly difficult. Watching a loved one lose touch with reality or pull away emotionally can feel like losing them before they're actually gone. But it's important to remember that this isn't something they can control. Instead of trying to force them back into conversations, the best thing you can do is meet them where they are. Speak gently, offer reassurance, and understand that even if they don't always respond, they can still feel your presence. If you notice a loved one becoming more forgetful, confused, or less engaged, don't ignore it. These are often early signs that the body and mind are preparing for the final transition. This is the time to be patient, cherish quiet moments, and focus on creating an environment that feels safe, familiar, and peaceful. Even when words fade, love and comfort can still be felt. Number 4, frequent infections and slow healing as the body starts to wind down. One of the clearest physical signs is a weakened immune system. You might notice that someone who rarely got sick before now seems to catch every cold, flu, or small infection that goes around. What used to be minor illnesses now take much longer to recover from, and even small wounds, like a cut or bruise, heal at a noticeably slower rate. These changes aren't random. They're signs that the body is no longer able to defend and repair itself the way it once did. One of the biggest concerns is repeated infection. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become more common as the immune system weakens. Many families assume these are just isolated illnesses, but when they happen frequently or take a long time to clear up, it's often a sign that the body is losing its ability to fight back. Even antibiotics, which once worked quickly, may seem less effective. The person may need stronger medications, longer recovery periods, or multiple rounds of treatment for infections that once would have been minor. This happens because, as circulation slows and organ function declines, the body simply doesn't respond to treatment as well. Another overlooked issue is chronic wounds. If you notice that small cuts, sores, or bruises aren't healing properly or keep reopening, it could indicate that circulation is compromised. Compromised blood flow means that oxygen and nutrients aren't reaching the skin and tissues properly, which makes healing much slower than usual. Pressure sores, especially for those who are less mobile, become a serious risk and can lead to dangerous infections if not carefully managed. What's even more concerning is that infections in the final stages of life often don't show up the way we expect. Instead of a high fever, an elderly person may just seem more tired than usual, more confused, or less interested in eating. In fact, for seniors, a sudden decline in mental alertness is often the first sign of an infection, even before other symptoms appear. This is why recognizing these changes early can make a big difference in how much comfort and support they receive in their final stage of life. For families, watching a loved one go through repeated infections can be both frustrating and heartbreaking. It's tempting to push for aggressive treatments, hoping that one more round of antibiotics or one more hospital stay will fix the problem. But at a certain point, the focus often shifts from curing to comforting. Making sure they stay hydrated, keeping their skin clean and moisturized, and minimizing stress on the body can be more beneficial to their well-being than another round of medication that might only prolong their suffering. If you're still watching this video and finding these insights helpful, please comment number 4 below to let me know you're here. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating valuable content to inform and inspire you. Now, let's move forward. Number 5. Major changes in breathing or circulation. One of the most telling signs that the body is preparing for its final stage is a noticeable change in breathing patterns and circulation. You might notice that your loved one is breathing more slowly or shallowly than before. Sometimes they might pause between breaths, or their breathing may become irregular, speeding up and slowing down unexpectedly. Some people experience a gentle, rhythmic breathing pattern called Cheney-Stokes respiration, where breathing alternates between deep, rapid breaths and long pauses. These changes can start out subtle, but over time, they become more pronounced and frequent. Another common sign is weakened circulation. You may notice that their hands, feet, or even their nose and ears feel cold to the touch. The skin may look pale, bluish, or mottled, especially around the fingers and toes. This happens because the body is prioritizing blood flow to vital organs, reducing circulation to the extremities. It's a clear sign that the heart is not pumping as strongly as before. Some people also experience more shortness of breath, even with minimal movement. Just sitting up, speaking, or shifting positions might cause them to feel winded or out of breath. You may notice them breathing through their mouth more often, or they may suddenly need to stop and catch their breath while talking. If they once had no trouble walking across the room but now struggle to do so, their lung function may be declining. In some cases, fluid buildup in the lungs can make breathing more difficult. This can cause a persistent cough, gurgling sounds, or even a feeling of tightness in the chest. Many people assume it's just congestion from a cold, but in elderly individuals nearing the end of life, it's often a sign that the lungs are weakening. This can make lying flat uncomfortable, and they may prefer to sleep propped up on pillows or in a recliner to ease their breathing. For family members, seeing these changes can be frightening. It's natural to want to help, to encourage them to take deeper breaths, or to worry that something urgent is happening. But in many cases, this is simply the body's natural way of slowing down. There may not always be a way to reverse these changes, and the focus should shift toward providing comfort and supporting them through this phase. Changes like these can be difficult, but there are ways to make your loved one more comfortable. Keeping the room cool, using a humidifier, or offering small sips of water can help ease their discomfort. In some cases, medications or oxygen therapy may provide relief, but the focus should shift toward comfort rather than trying to fix the issue. If you notice signs like changes in breathing, cold hands and feet, or a bluish tint to the skin, pay attention. These are often signs that the body is conserving energy and circulation is slowing down. This is a time to be present, offer reassurance, and create a peaceful environment where they feel safe and at ease. In these final months or weeks, the most important thing you can offer isn't medical intervention. It's comfort, dignity, and the knowledge that they are not alone. Final thoughts as we wrap up this video. Take a moment to reflect on what we've discussed. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation. These 5 signs often appear in the year leading up to an elderly person's passing. They may not all appear at once, and they might not always be obvious at first. But when you begin noticing them, it's a sign that the body is preparing for its final transition. For many families, these changes can be hard to accept. It's natural to want to fight them, to encourage a loved one to eat more, move more, or push through exhaustion. But sometimes, the best thing we can do is listen to what their body is telling us. Instead of focusing on trying to reverse the inevitable, we can focus on making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs isn't about fearing death, it's about being prepared for it. When you recognize these changes early, you can offer better care, make important decisions ahead of time, and ensure that your loved one's final months are filled with love and dignity. This is a time to cherish moments, share stories, and let them know they are valued and not alone. If you're noticing these signs in someone close to you, take a deep breath and remember, you are not alone in this journey. Many families have walked this path before, and while it's never easy, knowing what to expect can help you find strength, patience, and peace. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating valuable content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.